Distinguished ladies and gentlemen, you're welcome to this lovely day. All the young mothers here, the mothers of my age, the fathers, and everyone, good evening to you all. I'm called Dr. Roseline Achola. I work with the Ministry of Health, and I'm here in the capacity of a technical specialist for sexual reproductive health and self-care. And I want to tell you that as a country, we are privileged that we celebrate Mother's Day. And today being a Mother's Day, we are celebrating incredible mothers who are full of love, they are resilient, caring, and above all, sacrifice a lot. Congratulations and happy Mother's Day to you all. Secondly, I also want to say that I'm very grateful to stand before this big gathering, and I'm happy I'm back today to celebrate with all of us. And this tells you that RAHU is an organization that has dedicated itself to supporting the young women to see that every pregnant woman goes through pregnancy when they are healthy and thriving. I want us to use this moment to clap for RAHU once again and just say, RAHU! Because RAHU has brought us here. I know RAHU as an organization that has offered selflessly to reach the young people, the vulnerable girls, the young women, and everyone out there with information and services related to sexual reproductive health. And particularly, I want to recognize Humphrey. Allow me just say something brief about Humphrey. For 12 years, I've been working with the UN before joining the ministry. And from the UN family, we picked Humphrey as a young man, thriving, very committed, and his mission, vision really resonated very well with our mission of empowering young girls with information and services on SRH. And we've walked through that journey. And when I stand here today, I'm very grateful that Humphrey has reached this far with the entire team. Thank you for organizing this wonderful event called Mama Wange for us to celebrate mothers in style. It's a reminder to us that all girls and women deserve collective support. And for this support that they deserve, it brings them to realize their full potential, to go through pregnancy safely, and generally to experience health and well-being. Thank you so much for inviting me for this day, because I'm going to talk to you about self-care and birth preparedness. That how does a woman look after herself? However, you didn't intend to get that pregnancy, but the fact is you're pregnant. How do you take yourself through the 9 months? And that's what I want to reiterate today. I just want all of us to know that as a country, we are faced with a lot of challenge related to sexual reproductive health. And according to Uganda Demographic Health Survey, we still have high teenage pregnancy, we have low family planning use because they are not themselves ready, because they are not going through love, care, and all that a woman wants. I've ever seen a woman who said, Omsaja ansudde. Isn't that happening in our communities? Now, as a woman, when you get pregnant, you need to take care of yourself. You need to love yourself. Self-care begins with you. It begins with you. It will not begin with me or her to care for you. It starts with you. And one of the things that you need to consider, for example, nutrition. How do you eat? What quantity of water do you drink? At what time do you wake up? What kind of exercise do you do? It's very important as a pregnant woman that you love yourself and listen to the teachings. Do simple exercise. Put music and dance. I always tell people that I love myself. I put music. Even in my bathroom when I'm going to bed, before I bed, I first put music and I really go pakashini. By the time I'm ready to bed, I have sweated, I feel good, I feel happy. So that's what you are supposed to do. as pregnant women. Am I lying? So we need to feel good. We need to love ourselves. Even if the man has annoyed you, has to say, life is mine. When you die, when any woman dies, is she buried with the man? Even when you die and the baby also dies, do they bury them in the same grave? So it is you, the life is yours. I want to see every woman thrive. Go through 9 months pregnancy. Take the supplementation the way you are given. Folic acid, ferrous sulfate. It helps you to avoid abnormalities. It helps you to have a healthy baby. But we don't say that those who have babies with congenital abnormalities or any abnormality did not take it. We also have what is called danger signs. How does a woman check for the danger signs? There are many feelings. If I asked each one of you to tell me how you feel while you're pregnant, we can finish tomorrow. Some of you don't just want to eat. Some cannot sleep well. Some hate even to see their husbands. Some even don't want certain type of food. Some don't want to take medicine. But that is all the pain that a pregnant woman goes through. For every pregnant woman, you must have people around you whom you will share with your pain. Even when you don't want to eat, you will talk to that person. You need such a person because pregnancy is not easy. As Minister of Health, we always want women to pay attention to what we call birth preparedness, that the moment you've noticed you're pregnant, start your antenatal visit immediately. When you start your antenatal visit, no matter where you start from, but identify a health worker, a midwife, whom you are going to confine to, who will be able to give you all the information that you need. Okay? So identifying a hospital and a midwife is very important. Then you need to have somebody who will be ready in case they need blood from you. You must know your blood group and you must prepare somebody to stand by. Maama Kit is very important. The hospitals give Maama Kit, but women also prepare their own Maama Kits. So what am I telling you today? That as we celebrate Mother's Day, let's love ourselves as women. Let's practice self-care. Let's feel good. Let's laugh. So finally, I salute every mother. Thank you so much for coming today. We love you. You are the heartbeat of every family, the heartbone of our communities, the nurturers of all the children, and we honor you not only with words, but with actions that will safeguard your health, your dignity, and joy. Ministry of Health is committed to increasing the quality of care of all pregnant women and continuing to investigate causes of maternal mortality in this country through our weekly maternal and perinatal surveillance and death review. I applaud Rahu for working hard, and we also pledge to work with Rahu and other stakeholders to empower the young mothers in Uganda. Happy Mother's Day. May we all work together for safe motherhood and maternal well-being. For God and my country.